We are currently in the process of treating a virus that is in his bone marrow. The treatment for that is IVIG infusions over the course of 6 months. This hopefully will get rid of this virus in his bone marrow. Devin also had a brain aneurysm repaired several years ago. We routinely test and look to make sure that that aneurysm has not come back and that it remains stable. If Children's could no longer provide those treatments and services, I cannot tell you for sure that Devin would survive. That aneurysm would rupture. This virus would take over his bone marrow and eventually destroy it. And I know that times are tough and difficult decisions do need to be made by our lawmakers, but I just hope and pray that it will not come down to my son's health care. Children's has never given up hope with my son. I certainly have never given up hope. But at the end of the day, I hope the state of Minnesota does not give up hope as well. And there may be a day where somebody might tell me that there is nothing more that we can do for Devin. But imagine that statement if it starts with, because of budget cuts, there is nothing more we can do for Devin. Thank you.
I want to thank Melissa for sharing the story, her family's story. You're right. Your family's story can be repeated many times throughout the state. I think it's also important to note that as we think about families and family care and what's happening here, that happens because of trained professionals, trained nurses, doctors, paraprofessionals who are here to serve families. The budget cuts that the governor is insisting on in the healthcare area would affect the 20% of our economy, our non-farm economy, that is related to healthcare. And let's just put that in perspective. That means that there will be over 10,000 job cuts in the healthcare area, in the private sector and the social service sector. This is not a trend that we want to continue in this state. We already have a jobs problem. We are underproducing jobs in the state. And to make these drastic cuts means that not just the care for patients like Devin is affected, but whole other families are affected because of layoffs. And that just continues the cycle. It is very clear to most Minnesotans what is needed. A balance is needed. Cuts are needed, as the House, Senate, and Governor have all said. But unlike the governor, the House and Senate provide ongoing revenue into this budget that means that patients like Devin, families like Melissa's, will be able to depend on the care that they will receive. It is very clear to me that Minnesotans across the board think that we need a balanced approach and know, because of this sort of story, that we need revenue in this budget.